generally what we do, we just arrange our articles. What are the articles and where is the patient, on which patient where we have to give the demonstration. After that, what we do, there are basic rules whenever you have to perform the procedure on a particular patient. First of all, you have to check the basic vitals of the patient. Vitals is the essential part of the patient. Whenever you are providing any type of demonstration or procedure performing, you have to perform or you have to check the vitals. So related to the chest physiotherapy, vitals play most important role. I told you that what are the contraindications, what are the indications, what are the complications which we have to keep in our mind. After assessment of the vital sciences, the second most part is physical examination. You do have to go into the depth of the physical examination. You might be getting the class of physical examination, but general appearance check should be there of your patient to whom you are performing the procedure. You can't directly come up with the articles and be at the alternative side of the patient. After that, you can directly perform it. At least there should be a good gesture. You should also gain or attain the confidence of the patient. I feel the 90% is the confidence, 10% is the care. This is the right should be there. After the general appearance, what you have to check in case of the chest physiotherapy, you have to check what type of a basic sound is there, coughing, skin integrity, general vision. You have to check the orientation of the patient, whether the patient is oriented or not, whether the patient is abnormally or normally taking the breath sounds, or he is able to breathe properly or not. So these are the second part of the procedure formation. After the physical examination, what you have to tell? You have to explain your procedure to the patient. For example, I have to demonstrate on the chest physiotherapy. First of all, coming to the lab, I have to tell you that this is the chest physiotherapy. These are the articles. This type of pad should be there. And virtually, I will maybe explain that like this you have to perform. Same like that in front of the patient. You have to take the consent of the patient. After then, take the permission of the patient. After then, you have to explain the procedure to the patient. So this is the basic rule. Once the patient, if the patient is not able to give the consent, you can directly get from the parents or with the help of a doctor or a senior nurse, whosoever is there, you can directly take the consent from there. After then, what you have to do, you have to check whether the bedding is properly done or not. These are the minute things. Within no limit of time, you have to check these all things. So after then, you can perform the procedure successfully. If there is a female patient, then you have to provide the privacy. If there is a male patient, you have to maintain the privacy. In case of providing the chest physiotherapy to the female patient, I feel if the female might be or might not be comfortable with the male, so you have to keep those things in your mind. So you have to provide the proper privacy. So these are the basic and essential parts while performing any type of a physical examination. After that, coming to the chest physiotherapy, apart from the vitals, once you have done the vitals, once you have recorded the vitals, I have shown you the documentation. So with the help of documentation, what you will be able to do, you will be able to know that we are making a nursing documentation on a particular patient. So with the help of an identification data, name of the patient, what is the gender of the patient, what is the age of the patient, what is the diagnosis of the patient, and who is the doctor in charge, what is the ward. So this is a general outline of a nursing demonstration. After then, what we are keeping, we are just taking the time. At what time we have performed that particular procedure. So after the time, what type of medication we have done, we have given, whether that is what is the role, what is the dosage of that particular medication. At the end, we are writing what is the nursing responsibility. That is the most important part in nursing documentation whenever you are performing the chest physiotherapy. So in case of chest physiotherapy, what will be the nursing demonstration? In theoretical portion, what I told you that. So what is the general condition of a patient? If, for example, so this is my patient. So what will be my nursing documentation? So first of all, I have to check what is the orientation of a patient. For example, I have to perform the chest physiotherapy for the secretion or for the omit of the sputum collection in order to provide the proper breathing pattern. So I have to communicate with the patient. I have to make him comfortable. After that, I have to see that what type of breathing difficulty, does he need the normal physical chest physiotherapy, or he is having that excessive breathing difficulty. I have to measure the saturation, I have to check the saturation. On that basis of the condition, I have to see that what type of physiotherapy at what emergency level I can provide.